And I have my last set of guests right now. They come from the National Malaria Control Program. Mr. D. Levi Hine, he's the Deputy Program Manager and the Survey Manager. Joseph O. Alade, the M&E Officer, Assistant Survey Manager. We expect to have Madam Hawa Buya, the Coordinator, Case Manager at the National Malaria Control Program. Uh, Gentlemen, I'd like to say good morning.
Good morning.
Morning.
Yeah, good morning.
Okay, so today we're going to be talking about the malaria indicator survey. So I can start with the survey manager, Mr. Levi Hine, to just talk us through this malaria survey indicator. What is it all about?
Thank you very much, and good morning to all of you in the radio lane, and thank you for having us in your studio. So the malaria indicator survey is a scorecard for malaria control activities in Liberia. In the simplest term, it's a scorecard that shows what we said we wanted to do and whether we have achieved that, and what is our performance. So it's a performance indicator, performance rating card that comes up and brings out most of our indicators that we are using to tell whether we are making progress in fighting malaria or not. So in that survey, we are asking questions on the use of mosquito nets, whether people own mosquito nets, if they own it, whether they are using them, or what's the behavior of the parents in taking the children to the health facility as early as possible for fever and malaria, and even when they go to the health facility, they get the medicines, whether they are able to apply those medicines.
So these are questions being asked.
Yeah, so these are the basic things that we're looking at, and we're also looking at testing the children in the communities to see whether malaria children who are running around in the community still have malaria in them, and we're also checking for anemia children checking the blood status of children to see whether they are anemic, and the anemia is something about low blood.
Okay.
Whether children having low blood, and then we can refer them. So we're asking a lot of questions with different indicators on prevention, indicators on care for malaria, and indicators for communication, whether we are communicating, because you can have the interventions, and if you are not communicating, then people don't know where to access services and all of that.
Okay.
So it's a mix of several health system indicators that we're trying to measure, and those are going to show the progress of the health system and malaria control in Liberia.
Okay. So what has prompted, you know, the National Malaria Control Program to, in the first place, jumpstart this survey?
So the survey is international, or like I said, scorecard.
Okay.
I like to call it a scorecard. It's an international WHO pre-qualified survey
Okay.
that you must do every 2 years if you are in a moderate to high transmission area. Liberia is in a moderate to high transmission area. We have malaria all year round in the country. It's in every part of the country. People have malaria. People get sick of malaria 2-3 times a year. So we are in a moderate to high transmission area. So if we have money, we're supposed to do the survey every 2 years
Okay.
to measure our progress, because the survey measures the malaria burden. Every 2 years, you're supposed to know where you are, whether your burden is increasing or is decreasing,
Okay.
based on the interventions that you are
When was the
carrying
last
out.
time we had it?
So this is the 5th survey, and the last time we had it was 2016.
Okay. So it's
Yeah.
long overdue.
Yeah, it's long overdue. So you do it when you have money, because it's very cost intensive. So you do it when you have money, So basically, it is important for us because it brings out a lot of issues that inform our planning and also inform our donors where to focus and how to help the country in solving malaria problems in the country.
Okay. So let me come back to you. Let me come to you, Mr. Alade. What's the status of the survey now?
The status of the survey, we've gone over a month.
So it
Yes.
began
So
since.
we actually launched the survey on the 3rd of October,
Okay.
and the field work started immediately. So we've completed Moserado, including Greater Monrovia. We had 10 days in Monserrado, including Greater Monrovia. And the teams are presently in the 14 counties, that is excluding Monserrado. So we've gone a little over a month. So we've crossed the halfway mark already in the collection of the data.
Is the survey being conducted at every house
Now, let me
or malaria hotspots?
now actually, because when we say a survey, a survey is different from a census.
Okay.
Yeah, so when you do a survey, you randomize your population, and you select household at a random level. So we work with Legis. Legis give us a sampling frame, and from that sampling frame, we randomize 150 clusters in all of the 15 counties, including Monrovia. So we have 150 clusters. We have 33 clusters in Monrovia and Monserrado County.
Clusters, what are they?
So clusters is just a subset of communities.
Okay.
So you take a community, because you break the country into pieces. So every piece is a cluster.
Okay.
So
Pinsville could be a cluster?
Yeah. So Pinsville could be a cluster, and I'm sure Pinsville, it also depends on the population size.
Okay.
Yeah. So Legis does the partitioning of the country into clusters, and we just all Legis does, they give us the sampling frame.
Okay.
And we have the sampler who is in the United States.
And you model it after?
Yeah. So the sampler then use the sampling frame, and out of that they do a selection of the number of clusters we want to work in. So for this survey, we are working in 150 clusters
Across the country?
across the country. And the good thing, like I said, this is a survey, this is not a census, so we're not interviewing everybody.
And you're not going to every household?
We're not going to every household. So what Legis did, the clusters that Legis...
You may miss out on a household that has been affected so badly
because
by malaria.
Yeah, that's the beauty of a survey. The beauty of a survey is it's possible you may interview a household that has the burden. You may also interview a household that does not have the malaria burden. Like in Greater Monrovia, the burden in Greater Monrovia is very less, but the population in Greater Monrovia.
So where is Greater Monrovia?
Well, Greater Monrovia is what we call Monrovia, that's
Mama Point,
Pinsville, Congo Town, Douala, Loking Town, Garnersville,
Okay.
Jamaica Road.
Okay.
So those are the areas we call Central Monrovia. Then we talk about Greater Monserrado. Now we talk about Todi.
Okay.
We talk about Carisburg,
Bento.
Corwell. Those are the Greater Monrovia.
Okay.
Yeah.
Yeah. Okay, so, I was kind of asking, let me come to you, Mr. Hine. How long this survey is lasting for?
Yeah, very important question. The survey is lasting for 65 days, but we are not spending 65 days everywhere.
That's about 2 months?
Yes, a little over 2 months.
Okay.
So, like you rightly said, we did 10 days in Monserrado, Greater Monrovia and Monserrado.
Okay.
Because we had 33 clusters here. So we have 12 teams in the field, 12 teams that are spread across the country in the field. So what we did was the 12 teams work in Monserrado and Greater Monrovia for 10 days. And they were able to do the 33 clusters here for the first 10 days in September. So the 55 days are being spent in the rest of the country right now, as far as Maryland, Bapolu, River Cess, River G, and all of the 14 counties. They are there working right now. Yeah, so basically it's 65 days of work, field work, active collection of data, and as we collect the data, the samples, we're collecting blood samples for malaria children from children under 5.
Okay.
And then we also collecting samples for anemia, like I said earlier on, from the very children to figure out their blood status. Okay. And we are transporting those samples to the University of Liberia lab at A.M. Dougherty College of Medicine, where they are being tested, and they are being tested there. And later on, by early next year, we'll have the survey results to know what the prevalence of malaria is and what the anemia prevalence is or for Liberia. And then we'll also be able to figure out what is the net ownership in Liberia. How many people own net? Because in 2021 we distributed a little over 2 million nets, almost nearly 3 million nets, and since 2008 we've been distributing nets in Liberia, and we can probably say we've had more than 2 billion nets that have been put into the community since 2008, and we want to know whether people are using these nets, whether they actually own these nets and they are using them.
It's a year now. Is the net even still available?
Yes, those are the things we are investigating. Now we want to know how the nets can be kept in people's hands, because people can have the nets, they are not using them. So we asking them questions, why are the reason you are not using the nets?
Okay.
So they're going to tell us, and that's going to impact our program planning. So when we are planning, because we have an opportunity to plan in 2025,
Okay.
our strategic plan is running from 2021 to 2025. So this information is going to help us to plan in the next planning season from 2026 to 2030 to determine what interventions we need to deploy against malaria and that the population will accept. Because there are two things. You can have an intervention, and if the population doesn't accept the intervention, you're not going to make progress. So this survey is asking questions that are going to inform program planning and for our next phase of our intervention in the next 5 years, beginning 2026.
Okay.
Yeah.
So let's look at those conducting this survey. Who are those? Were they recruited?
Yes. In August this year, we placed an ad on a eMarshon website, and we advertised the various positions. So we're looking for good interviewers. We're looking for biomarkers. Biomarkers are the people who are doing the testing in the field. And then we're looking for lab technicians, microscopists who will be reading the slides in the lab. And then we're looking for logisticians, slide logisticians who will be transporting the slides from the field to the staining sites. So we are working with different cadre of people, including people in selected hospitals across the country who are lab technicians that are staining the slides that we are transporting. So we have 70 field staff right now
Across
the country. Yes.
and how many team members assigned to a cluster, for example?
So the 5 team members are assigned to a cluster. We have one supervisor.
Is that enough?
Yes, that is enough. Because we have.
Is it to international standard? Doing survey, standardized
Yes.
survey, is that
So they are paired. You have one supervisor,
okay?
and then you have the 2 interviewers and 2 biomarkers. So you have an interviewer and a biomarker as a sub team, because when the interviewer get to the household, they're supposed to interview the head of the household or a designate, and then also interview all the women of the ages between the age 15 to 49 years. They're supposed to interview those women, and then they're supposed to interview all the children between the ages of 6 to 59 months. Under 5 children. They're supposed to take blood samples from them, speak to their mothers about their healthcare, of their health-seeking behavior and how they are managing them for fever and all of those things. So you have to have one interviewer and one biomarker working in pair, and then the supervisor will be going between the 2 or sub teams to work in a cluster.
Okay.
We are having 30 households in each cluster. So it's expected that each sub team will do 15 and the other sub team will do 15 over a 3 days period.
Okay.
Yeah, so we spend up to 4 days in the cluster, because we have to map the cluster. After mapping the cluster the first day, because what Legis did, Legis were able to show us where we're going. But then people are moving, especially in urban areas. Legis could come here today and meet you and say, okay, this is your household, and you won't tell them that you are planning to move. So to leave your name here and say, Levi Hinen lives in our house. Some of the challenges we're having when you get to the household, they say, yes, Levi was here, but he moved. He moved out. So then we have new occupant in the household. We have to interview that occupant.
Replacing
Levi Hinen. So those are some of the things that we continue to see in the field.
Okay, so Mr. Alade,
Yeah.
was the recruitment done, in the county, or you took them from Monrovia, to Sino County, for example, to conduct the survey? How was it done, and how much are they being paid?
Okay, let's look at it this way. We did not select people from a specific county.
Okay.
We pulled out the advert on the e-marshal, and everyone from everywhere had an opportunity to apply. So we did not look at which county you are from or which county we want to send you to. So all those I applied came from different counties.
Okay.
So they went through a training. So our work as a program was to recruit.
Okay.
We put out the advert, we did the shortlisting, and we turned the whole process over to a consultant that came from RCF, that is from the DHS program that is based in the United States. So they did the training, and after the training, they did a selection of the participants, because we recruited like 50 interviewers. Actually, we needed 24 interviewers plus 12 supervisors, 36. But we recruited more 50. We recruited 24 health technicians that we call the biomarker. In essence, in reality, we needed 24. But we created a condition where people would enter the survey through a competitive means. So the training was done. Everyone went through the competition, and 36 interviewers, including the supervisors, and 24 biomarkers, which we call the health tech, were selected for the fieldwork. So to answer your question, the participants came from all over. So our work was just to do the recruitment. You apply, we recruit you. You go
And
through
deployment.
yeah, you go through the training. When you are successful, you form the team. Like Levi was saying, we have 12 teams.
Okay.
Yes, we have 12 teams. Each team had a minimum of 12 clusters to go to. Because remember we said we had 150 clusters. So each team had a minimum of 12 clusters. And just how the selection was done randomly to get the number of clusters we needed, there were also a random selection to select the household to be visited. Now, so in each cluster, 30 households were selected. Now, the households are different from the structure. A structure may have more than one household. So during the randomization, it is possible that two households could be selected from a structure.
Oh, okay.
But in total, we needed 30 households per cluster. So to add up to what Levi said, the teams, the member of the teams are sufficient enough. Like we have 5 persons per team. They are sufficient enough to do the data collection.
Okay.
And to add up to it, the malaria indicator survey, like Levi said, is actually a population-based household survey. Now, at our level, we have our routing data that tells us what we are doing. The routing data comes from the health facility. So when we distribute the nets, we have the data. But the MIS is a population evaluation of the malaria program, because we are not there. We did the intervention. So the population now is evaluating what we have done. So the data is coming from the population. We distributed 2.5 million nets 2021. What is the net ownership among the population? The population will tell us. Are they sleeping under the nets? They will tell us. What is the access? Because we say for access, we say at least 2 persons to a net. So we measure the access. And what is so important is the prevalence of malaria. Now, prevalence is determined by the UNO5. The malaria bred in every country is determined by the small children.
Okay. Those that
Those
children that are affected.
Yeah, no, just small children as a whole. Those between the ages of 6 months to 59, from 6 to 59 months.
Okay.
It's simply though I'm not a clinician, but it is because at that age
They are at risk.
they are at risk. They don't have the immune system is not
Yeah.
that strong.
Yeah.
So globally, they determine the prevalence of a country based on the UNO5.
Okay. So, Mr. Hine, since you are the survey manager, I mean, let's just announce that we've been joined by Madam Hawa Boya. She's the case manager, the coordinator. Madam Boya, good morning.
Good morning. How you doing?
I'm fine. I will come back to you. So, Mr. Hine, I was asking, how much are these people being paid?
The survey is paying they are making I don't want to call it monetary value of what they are making because I mean
That's privacy.
that's their privacy.
Yeah, but
because-
I mean,
so we are
but-
paying them. We are paying them.
but it's good, right?
Yeah, we are paying them something good. That is going to sustain them in the field,
Okay.
and also when they come back, we give them 50% of what they're supposed to have,
Okay.
and then after
Inclusive
the
of transportation,
transportation
feeding,
and everything, we provided vehicles for them.
Okay.
Each team has vehicles, and then where they don't have, where the vehicles can reach, we facilitated conveyors.
Okay.
We have conveyors, where they can hire their own motorbikes
Okay.
and go into clusters because we have some places in
Hard to reach.
very hard to reach areas in Riverside, in
Yeah.
Maryland, in Bapolo, in Green Crew, Sino,
Yeah.
all of those places. They are very hard to reach areas. So we improved the survey this time around by providing conveyors to move them with motorbikes and where the cars can reach. So each team has a vehicle.
Yeah, asking because I mean it is a technical issue and I mean it's one of the reasons that can lead to
All
you
the
don't
noise.
take care of if you
Yeah.
don't take care of your survey.
Yeah, but the malaria control and the Ministry of Health has a reputation, of paying people. Sometimes we delay to pay, but we got partners that and the government has always supported us in making sure that we keep that reputation. So this time around, I mean, like before, they have something that they can work with, and it's not going to be a problem in
Okay.
terms of payment. Yeah.
So let me come to you, Madam Boya. I mean, we've said a lot about the essence of the survey, but how important it is, this survey in fighting malaria in Liberia.
The survey is very important because it
You
will-
want to draw the microphone small down to you. Okay, great.
the survey is very important to our country because it will tell us the prevalence rate
Okay.
of malaria. Okay?
Mhm.
And especially this is the fifth survey, and the last one was done in 2016. And by then we used MRDT.
What
But
is
this time around malaria, the rapid diagnostic test.
Okay.
But this one, we are using the gold standard, which is microscope. And as Mr. Alade said, we are using, to get the prevalence rate, we are going to use the under 5 from 6 months to 59 months. So all the positive cases within the age range from 6 months to 59 months will give us the prevalence rate to know where we are in Liberia with all the interventions we have put in place. I think you people discussed that we are distributed net. We are also giving IPT, intermittent preventive treatment for pregnant women when they go to the facility, and those are some of the information we'll be gathering from this survey, and also the utilization of the net.
So now,
Okay.
not only are you getting information or interviewing them,
We are interviewing
you are
them.
also
Yeah.
giving them nets.
No, we are not giving them. We are we are asking them the ownership of net and the utilization. How well are they using the net?
Oh, okay.
Okay.
So I mean, when you come to my house, you interview me. What do I get? Are you giving me something on site?
No, we are not giving something on site.
Oh, okay. You are saying about the rapid. I thought you doing testing
We are doing testing
on site.
on site
Oh, okay.
with the rapid diagnostic test, where we give the result right away from 6 months to 59 months. Those cases are fall within our EA ranges, and also do the tech smell where we send it to the lab
Okay.
for staining, and from there for the microscopic to be able to check.
Okay.
So that from there they will get to know the prevalence rate, how
Okay.
many positive cases.
Okay.
Okay?
Yeah.
So this survey is very, very important. With all the intervention that we have put in place, we want to know where we are when it comes to malaria.
Okay. And Mr. Hine, how do you, make your respondents respond in a way that you get the information? Because some environments can be very hostile, you know. So I mean, were the surveyors trained on how, to be very persuasive and talk moderately to your respondents so that you get the necessary information?
Yeah, that's a very important question. Yes, we don't force ourselves on people, or the survey is playing in a way that they consent. You must agree to talk to us before we can talk to you, even if your household is selected. So that personal rapport is built between we and you
Okay.
to explain the importance of the survey and to explain that your answers represent the answers of so many people because we did not have the opportunity to talk to everybody in the country. So the fact that we're speaking to you, there are several people who have the same condition that you have in your household. So by talking to us, you are providing answers for a whole lot of people. So we seek your consent and you sign that written consent and say, yes, I agree to talk to you on this, and then we start. Now, while the interview is going on, our experience shows that some parents are skeptical to have their children tested. They want to know where you're taking the blood, why you're taking the children blood, and all of that. We can also try to explain that to you. But our community engagement starts at the county level. It started at the national level. So we have the Ministry of Internal Affairs involved. We are working jointly with LEGIS, the Ministry of Internal Affairs, and all of the other health partners and the county health teams and the county administration in the country. So we got the Ministry of Internal Affairs backing. So when we do our community entry, we don't just go to the household because we sort of go to John Brown House. No. When we enter this community, we go to the town chief. We serve the town chief the letter from the Minister of Internal Affairs. We serve the town chief the letter from the Ministry of Health. The town chief reads the letter and then speak to the town people and say, these people are here to do XYZ. They were sent by the government. So that's the first level.
Yeah.
Now when we get to your household, you still have to sign that your
Consent
informed
form?
consent, yes,
Okay.
as being in agreement. And you also can say you don't want us to test your child. We're still going to go back to you to appeal to you to test your child because your child blood is important for us to know the malaria status of the country.
But was there an awareness done beforehand?
In survey, you don't really do awareness because sometimes awareness can lead answers. We don't want to
Okay.
lead answers. So what we do, we have an announcement on the radio, something like an announcement
Okay.
explaining the importance of the survey.
That a survey will be
The
conducted.
survey will be
so and so
conducted,
time.
yes, and then people need to respond to the people
Okay.
because it's getting XYZ. So when you do awareness, then you almost inciting people to say, I have net, I don't have net. No, we want independent answers to come up that will actually show us where we are in terms of the fight against malaria.
So at the end of the survey, I mean, in total, how many respondents are you targeting?
Okay, like I said, out of the 150 clusters, we are interviewing 30 households. So it tells us that 3,500 respondents in the households. And we are also targeting like 2,700 eligible women. Those are women between the ages of 15 to 49 years. And we are also targeting a little over 3,000 children under 5.
Okay.
Now, like what Levi said, every survey has ethical issues. So before you do the survey, you have to send your protocol to the ethical board, and there are basic things the ethical board expect to be in your survey. And informed consent and confidentiality is very, very important. So we include all that. Our data collectors were trained over a period of 12 days. So we give them all of the techniques in conducting a good interview. So they have the skill to persuade people, to build rapport with their respondent. We don't force in a survey. You don't force people because you want somebody to give you the answer from their heart.
Yeah.
So we do all that. We also talk because you see, like I said, to determine the prevalence of malaria in every country, you have to look at the children under 5. And prevalent means people that have the disease but still moving around.
They're sick.
They're not sick. It is incidents that take them to the facility when they're sick. But prevalence, so what we do, we don't rely for the routine data, we rely on our incident data. But for the population data, we go for the prevalence because the children are in the communities playing, but they have the parasite. They have the malaria parasite is in them. So that's why the testing is necessary. So
But I mean, in Liberia, one of the common causes of malaria is, untidy environment, filthy environment.
but
So during, this survey, is that something that you tell, the community people or the household, especially when you go to a household that has, the environment is not really clean. Do you tell them? I think
So the thing is, let me answer that. The thing is the survey is measuring our progress, what we have done. So before the survey,
but it's also indicating the prevalence.
yes, the prevalence is also measuring our progress. The prevalence is one of our report cards, our schools. So the issue is, before the survey, we were doing health promotion. Before the survey, we distributed nets. Before the survey, people were in the hospital treating people. So now, during the survey, we are here to find out all of these things we've done before, where we are with them. Did the people get the correct message? So we're not educating people during the survey. We educated them before the survey. So we are
To
now
clean the environment.
Yes, to do all of those things. Sleep under the mosquito net.
But you go to an environment, you see.
Because the survey needs to be independent. The information we're gathering, that's why we are not using Ministry of Health staff. That's why we recruited the people, because they are going to just do what we send them to do, and they're going to give us our results. So when they come back and say, most of the women we spoke to said they never heard malaria message.
Okay.
You understand? Then we understand that we're supposed to improve our messaging. If they come and say most of the women said they bought their drugs from the drugstore because every time they go to their facility, no medicine there, then it means we have to improve our supply chain in the health facilities. If they come and say XYZ, then it means we need to improve. But if they came and said, oh yes, people said they saw the message, they told us the right message, because we'll ask you, have you heard any message about malaria? You say yes. What kind of message you heard about malaria? Somebody will say, they say we should sleep under the net, or they say we should do XYZ. Now we already programmed those messages in our survey tools to show which message they talk about. And if they didn't talk about any of those messages listed, what the people going to say, we have the option of specifying what they said. Okay. So all of that going to inform our planning in the future. So at this stage, we are not educating people what they should say.
Okay.
We want to bring what we have done out of people's mind and what their practices are, because it's about behavior change. It's about what the practice is with health practices, and it's about your attitude, your own attitude after you get our interventions.
Okay, so if you just joined us, you're listening to the Super Morning Show on ELBC Radio with me, Vafle Kamara. I have 3 guests: Nadine Lever-Hine, the Deputy Program Manager, Survey Manager, Joseph O. Alade, the M&E Officer Assistant Survey Manager, and Madam Hawa Boya, Coordinator Case Manager at the National Malaria Control Program. Before I go to the phone line, Madam Boya, prior to conducting this survey, what was our status with malaria? Was it at a rare case, or was it prevalent? Or any of you who are.
okay, so let me,
Yeah.
like we said, Liberia, the burden of malaria in Liberia is between medium and high.
Mm-hmm.
So normally we consider Liberia to be a high burden malaria country. So we say malaria is endemic in Liberia. Now, if we look at the health system, malaria accounts for 34% of the outpatient attendance at health facility level, and 24% of inpatient death. So it tells us that we still have a high burden. despite the fact we are making progress.
Mm-hmm.
Now, our prevalence level now is at 45% using malaria rapid diagnostic test. And that's why this survey we are using the same malaria rapid diagnostic test and the microscopy,
Okay.
because our DT has its own limitation. So our DT can tell you that you have malaria and you may not have malaria. So the microscope will do the confirmation that this man case, yes, he's positive, he has malaria. Now, we have made progress. Let us understand that over the years we have made progress. Yeah. Our case incident rate, which we call the annual parasite incident rate, has dropped significantly. That is, those that go to the facility with history of fever and we test them, it has dropped significantly. Like the honor 5 in 2017, we had over 680 honor 5 out of 1,000 children coming down with malaria at the health facility level. But today, from our intervention, we have dropped below 500 out of every 1,000. Like, remember, we told you the children are the most vulnerable population when it comes to malaria. So attention is paid to the honor 5. Okay. Anytime we're working with data, we pay keen attention to honor 5. If our honor 5 malaria cases drop, it means we are making progress.
Okay.
If the honor 5 malaria cases continue to rise, it means there is an issue.
Okay.
So for now, we have also reduced malaria death. So malaria death per every 100,000 honor 5 has dropped from 22. It was over 22%, 22 honor 5 children. But now we have only 7 honor 5 children dying from malaria. So you see, the interventions are working.
Okay.
And the data coming to us is from the health facility level. But the data now that we need now is from the population. So now it's the population that is going to tell us about exactly what our interventions have done and where are we with respect to malaria. So,
Okay.
so we are making progress.
Okay.
Malaria cases are dropping. Malaria deaths are dropping. The mortality rate for malaria has dropped for both the general population and the honor 5.
Okay.
So, but despite those progress that have been made, malaria still remains a major public health problem in Liberia.
Okay. Lastly, Mr. Hinen, when do we expect the result from the survey to be public?
By June next year,
Okay.
we will have the results, because we expect to leave the field by the 13th of December. The good thing about this survey is that we are collecting the data using tablets, so we are not going to have a period of data entry like in the past, where we'll spend 3 to 4 months to enter data before we start analyzing data.
Okay.
So the last hustle will be interviewed on the 12th of December this year, and after that period, we'll start. What's going to delay us is the reading of the lab, because we expect the specimens to be in by the end of December. All of the specimens to be in, and then by January 31st, we'll finish reading all the lab slides, and by then we start analyzing the data. And we're going to analyze the data between January to March, and then the report writing will take 3 months.
Okay.
It will take 3 months, because we are working in collaboration with the Demography and Health Services Program in the U.S. They are leading the survey, so we are working with them. So it's a collaborative effort along with LAGIS and other health partners to be able to come up with that report. So by June next year, we'll have the report, and we'll start disseminating the reports nationwide. We're going to come back here again
Okay.
to talk about the results.
Okay.
Yeah.
Okay, so you can call us on 077-058-1886, 080-514-096, 077-058-1886, or 080-514-096. We are talking about the malaria survey indicator that's going on across the country. And my guests are D. Lever Hine, is the Deputy Program Manager at the National Malaria Control Program and also Survey Manager. Joseph O. Alade, the MAE Officer and Assistant Survey Manager. Madam Hawa Boya is the Coordinator for Case Management. They here as my guest on the Super Morning Show. So you can call us on 080514096 or 0770581